So welcome everybody. Good afternoon to everybody in this room and all the people who are watching and following us online. My name is Elena Moro. I'm a clinician, a professor of neurology at the Grenoble-Alpes University, Grenoble, France. I'm the current president of the European Academy of Neurology, an association covering 45,000 neurology in Europe and representing 48 countries in Europe. Why we are here today? I think we want to change the future. We want to shape the future of brain health in Europe. We are here because our brain is healthy, because we can talk, we can move. So we want to preserve it, not only for us who are here today, but for all the people in Europe and beyond Europe. So before going through the program of this session, which will last 90 minutes, I want to define, just to understand with you, what is brain health. So we are following the WHO definition. Brain health is a state in which every individual can realize their own abilities and optimize their cognitive, emotional, psychological, and behavioral functioning to cope with life situation, which means that we involve neurology, we involve psychiatrists, we involve psychologists. We are very inclusive in this definition, which is vital for everybody. So the way that we shape this session today, we will have a two-panel discussion. The first panel will talk about brain health, neurological and mental health, and their economic and social importance. The second panel will discuss policy framework and national strategies for brain health. Then we will have some round-the-table discussion, and I will let Fred to talk about that. And then we will recap, and we will go home with some key messages, with some action to take when we go back home. So now it's my pleasure also to introduce Fred Destrebeck. He is the executive director of the EBC in Brussels, the European Brain Council, which is a very important organism in Europe, and he will tell us maybe a little more about EBC. And so, Fred, if you want to introduce the session.
Thank you very much, Elena. Good afternoon, everyone. My name is Fred Destrebeck, as Elena introduced. I represent here the European Brain Council, so we are an advocacy network in Brussels, representing patient organizations, clinical and scientific societies, among which the European Academy of Neurology, being a founding member of EBC, as well as industry partners and networks of national brain councils. So it's really a pleasure to be in Gastein and to move the needle on the greater recognition of brain health, but also of this understanding of what it does represent. So I'll be moderating the first panel, contributing to the discussion and helping also moderate the roundtables together with colleagues. So those who are trying to hide at the back of the room, nice try, but you'll be asked to jump at the front later on while you be called. So I would like to start with the first panel discussion on brain health, neurological and mental health, and the economic and social importance. And I'm pleased to call on stage our panelists, so Martina Rojnić-Kuzman, Paul Bohn, and Harris Eyre. Please join me on stage. And I can maybe also start with a word of introduction. So Martina is a board member of the European Psychiatric Association, another member association of EBC. Paul Bohn is the past president. Free sitting order. It's like it's a family dinner, so help yourself. So Paul is the past president of the EN and professor of neurology in the University of Ghent in Belgium. And Harris has traveled overseas to come with us. So Harris is the founder of the Brain Capital Alliance, but also researcher at the Rice University and Baker Institute in the US. But originally, Harris, you come from Australia. You'll tell more about that in a moment. So welcome. Thank you for joining me. Martina, I wanted to start with you because I think that when we talk about brain disorders, when we talk about challenges, everyone in the room and everyone in the EU health policy bubble is aware of the burden of mental health. But can you lead us through your perspective as a psychiatrist on what are the key challenges, the key unmet needs, and the key priorities in the area?
Thank you very much for the questions, and good afternoon to everyone. So I'm just going to a little bit explain about European Psychiatric Association, but just one sentence. That the European Psychiatric Association is the largest association in Europe, and we have individual members and also national associations. There are 44 national associations from 43 countries of Europe. Actually, by that, we estimate that we represent roughly some 80,000 80,000 psychiatrists in Europe. And regarding the challenges, what we actually did, it's in the end of the 2023, before the election, we have issued a European EPA manifesto and made an event within the European Parliament where we actually issued the document saying what we think are the challenges and the priorities related to mental health and what we would like to see tackled in the period of the several next years. So first, we think that it's very important to acknowledge that in psychiatry we have had an advancement of very good treatment options in terms of different psychiatric disorders, but there is still a very large difference when it comes to availability of these services. So we have not harmonized treatments all across Europe. So first challenge would be to optimize the treatment all across Europe and to harmonize it. It would be the first challenge. Because before we used to, for example, treat schizophrenia, and we were very happy if a patient with schizophrenia had remission of symptoms, but they still led a very poor life. Now we know that we can help them very much in a way that we are unhappy if patients with schizophrenia do not have a leading life, having partners, having academic success, having jobs and everything. So we think we have a means to optimize treatment. But it's not available everywhere in Europe, and we want to harmonize that. And the second challenge is actually relating to the knowledge that the biological and the environmental factors in producing mental illness are interconnected, and we know how the environment affects the mental illness, their development and their progression. And therefore, we want to tackle the effects of newly developing world in terms of the effects of urbanization, in terms of the effects of climate change, in terms of the effects of even artificial intelligence. And we want to focus more funds on the public mental health. So basically, that would be what would aim for, especially on the latter concerning the socio-economic determinants of health.
But obviously, this afternoon we're discussing the concept of brain health. I mean, as Elena was mentioning, there is this holistic and englobing definition provided by the WHO. So how do you see the potential and the benefit of integrating those priority needs into this, let's say, bigger umbrella and bigger agenda?
Well, I think it's necessary. I think that psychiatrists and neurologists definitely should collaborate, and it's actually the only way to go. There are many similarities. There are similarities when it comes to topics. For example, many of the people with psychiatric disorders have also neurological problems, like people with severe mental illness have very high incidence of cerebrovascular disorders. Then people with neurological disorders, like, for example, people with multiple sclerosis, have very often psychiatric illnesses like depression and anxiety. So there are common topics. Then there is also, I think, common preventive strategies. So if we want to aim for a healthy healthy population, which means having healthy lifestyle. This will tackle also the neurologic disorders and also psychiatric disorders, if we want to have more exercise, more healthy food, diet, and everything else. And third, also, I think we employ similar strategies. We, both psychiatrists and neurologists, want to have their ideas also headed by the policymakers, and we want to eventually implement it. So I think it is very logical that we go together. Of course, there are differences in our opinion and viewpoints, but I think this is just an advantage, because then we can tackle the problem from different perspective, from wider perspective, and it just opens the more comprehensive picture.
Thank you. Paul, I would like to bring you in. You are a neurologist, so can you maybe explain to us what is a neurological disease, and what is the impact on society, and I would say on people living with the neurological condition?
Well, thank you very much, Fred.
Yeah.
And thank you to the organizers for inviting us to this panel. Well, what is a neurological disorder? Typically, neurological disorders are the somatic part of the brain disorders, as opposed to the mental disorders, which are the mental part of brain disorders. Basically, the organ that is ailing is the same, but the presentation, the semiology, and also the prevalence and the consequences may be different. Now, what is really the starting point if we talk about the importance of neurological disorders? It is about the staggering prevalence. According to the most recent data, and they've just been published earlier this year, of all people, the entire global population, at least 1 in 3 people have a neurological disorder. And if you specifically look at sick people, so the burden of disease, total burden of disease, we're talking about more than 40% of the burden of disease is associated with neurological disorders. So the figures are staggering. Now, if you ask what are the social and the economic consequences, well, they are in relation to these staggering figures, they are also very, very important. Very briefly, what do we see? On the social level, it really starts from birth. If there is a neurological disorder, there is issues at home. There is issues in school. There is stigma all over the place. There is problems with family, with children, normal expectations in life of many people. There is problems with employment. And just very, very, very simply, many people with neurological disorders cannot drive a car. I mean, just if you ask yourself what is the social consequence, it is huge. In terms of economic consequences, well, I mean, the figures are just crushing. According to the most recent calculations, the cost of neurological disorders in Europe is above 1 trillion. Just imagine that we could save 10%, 20%, or maybe 30% by preventive measures. It would make an entire difference. We could...
I'll take you on that one. What can we do? That's
right. Well, that is the thing. The general awareness in the European community, the entire society, but certainly also with professionals, with people, with different stakeholders, is too limited. People are not aware about these staggering figures. People are not aware that many neurological diseases, first of all, exist. Secondly, that they are treatable. The idea still remains that many people with neurological disorder cannot be cured. And more importantly, most importantly, thirdly, many people do not know that many neurological disorders are preventable. If I just take a few examples, stroke, 20–30% of the strokes is preventable. Dementia, at least 30% of dementias is preventable. Epilepsy, just to name the most frequent neurological disorders, many are preventable, and we are in general not aware about this. So, in a nutshell, that is really what I wanted to say. Starting from staggering figures of prevalence, lack of awareness, and lots of things that can be done.
Okay, and if we go into the scope of prevention, and I would even include promotion of brain health, when you were president of EN, you spearheaded the creation of the Brain Health Mission. Can you talk to us about that? What was the purpose, the objective, and how does the mission, let's say, unfold currently?
Well, thank you for asking the question. What do we really want to achieve with the Brain Health Mission? It is an initiative taken by EEN, but it is really meant to be the most inclusive platform for brain health that we know in Europe. What is the idea? Well, we have many platform organizations, we have many collaborations, and I'm looking at my colleague here, our prime partner as in the clinical world of brain disease is obviously the psychiatrist. We work together with pharma. These are, I would call, the usual suspects. With other medical associations, the most important partner, apart from our colleagues, is the patient organizations. We work together very closely with one overarching patient organization and with many individual patient organizations. However, what we wanted to achieve with the Brain Health Mission is to also include other stakeholders. And I'm talking about, for instance, industrial partners who are not part of the biomedical biotope, of the biomedical ecosystem. We are talking about educators, we're talking about the general public. And very simply, to be very short, what are the prime aims of what the Brain Health Mission wants to achieve? Really at 3 levels. We want to reach the general public. And I like to make this metaphor. Children know what dental hygiene is. They learn how to brush their teeth at home and in primary school. We want to introduce this concept of brain health in primary schools in order that the next generation will know, next generation of kids will have a natural feeling, a natural affinity with brain health. Secondly, we want to talk to our own backyard, which is the healthcare professionals, give them a better idea, a better concept of brain health. And lastly, we want to talk to policymakers, politicians, make sure that we do something about this lack of awareness. Just mentioning one other thing, I mentioned the staggering figures. There's another staggering figure. 40%, more than 40% of burden of disease, less than 10% of funding. That is a key problem in Europe.
Funding for research and public health intervention.
Yes.
Yeah. Okay, we may come to that in the conversation. Thank you, Paul. Harris, I'd like to bring you in because we moved towards a kind of angle towards society, and Paul also mentioned involving industrial and private actors. So getting to Gastein is an interesting experience and an interesting journey for all of us, but you've flown overseas to come. So I'm really tempted to ask you, why did you bother? And what did you want to convey as a message today? Because you've been working on concepts around the brain capital and the brain economy more lately. So can you tell us about that and what are those concepts? And how do you think it's meeting the needs expressed by Martina and Paul?
Yeah, okay, so microphone's on. Thanks everyone for being here today. I'm here all the way from California and Texas. I live in both places because I'm very interested in coordinating between the United States and Europe. And so maybe we call it the NATO for brain health. That's a bad dad joke, and I have a new baby girl, first child, so I can make dad jokes, I think. But so I'm trained as a clinician and a neuroscientist, but you could consider me now, I'm a societal neuroscientist. That's really, I live in the world of private sector, public sector, and philanthropy, and trying to connect the dots between public, private, and philanthropy. And fundamentally, I believe that, as wonderfully evidenced by my 2 previous speakers, our brains are currently in the red, right? We have all these challenges that have been described, not least the proliferation of disinformation, the worsening of climate change on our and the impacts on our brains, and generative AI, which is causing all sorts of stress. So our brains are in the red right when we need them in the black. We need our brains now. The World Economic Forum says that the 3 most important brain skills are analytical thinking, creativity, and resilience. And we know that in Europe and many countries, we're going through lots of big transitions, and these are skill-intensive transitions, like Europe is pioneering the green transition. And the green transition won't happen unless we have advanced skills so that people can invent and build things for the future, for a greener society. So again, our brains are in the red when we need them in the black. And what I am all about is working with my experts in psychiatry and neurology and trying to place brain stakeholders at the heart of a new economic transition. That's this brain economy transition to move from a brain unhealthy society to a brain healthy society. Because if we don't do this, we face a massive, I think, existential risk on the scale of climate change, as you mentioned, the $1 trillion costs. If we don't transition and if we don't take a systems change approach across all sectors, so this is not a transition, this is actually a transformation across all sectors. That's what I'm doing in the US and what I'm coordinating with European colleagues on in the context of the European Commission and other European stakeholders.
So if I summarize, this is really a concept really in the field of blue sky thinking, so to say. Sorry to summarize it that way. But do you have more, let's say, tangible and concrete examples of what this transformation would actually mean, or how that could benefit in terms of the challenges expressed by Martina, notably?
Yes, so I'm conceptualizing, we have many sectors in society, health, digital, climate, and the current setting of these sectors is we have low brain capital in society. We have poor brain health and brain skills are insufficient. We need to increase, like on a DJ's mix master, increase the volume, but increase the brain capital and think about it sector by sector. And so we just actually did, do you like that one, Fred? Does that work?
Well, actually, I would like to propose next year that you come and we make a brain party or a brain disco.
Okay,
That's
yeah,
perfect.
so we'll make some remix or something. But so we just did this 3 brain days at the United Nations General Assembly last week in New York, and we specifically curated conversations on these different sectoral themes. And I'll just give you one example. I'm happy to talk about it with folks afterwards, is the built environment. The built environment, we traditionally didn't think that it was at all relevant to our brain health, but last week we were talking with neuroscience designers and neuroscience architects from 2 major companies and academic institutions to develop building standards to improve the quality of building on our brains. That includes things like air ventilation, and you'll be glad to know that we opened up the windows for you so that the carbon dioxide is lower and your brain performance is better. Anyway, and there are many different ways that we can change the built environment with lighting and things that actually boost your creativity and boost your productivity. So but we're working across this in all sectors, and working now with Fred, we're building a systems change methodology across all sectors, and this is what we'll be doing with the EAN.
Okay. Thank you, Harris. I see that time is running, so it's probably time also for a word of conclusion for this panel before we move on. Actually, I wanted to ask you for a 30-second statement about the urgent priority needs that you would like to express towards policymakers, given the sense of urgency that we just expressed, but also given also the potential to move ahead. And I'll start with you, Martina.
30 seconds. Okay. So I would focus then on 2 points. One point is, as I said, there is a need to give everybody the optimal treatment for the mental health that we have. I learned that schizophrenia is a chronic debilitating disorder which ends with deterioration for individual. This is not true. We can rehabilitate people with schizophrenia to complete rehabilitation, to complete recovery. This is an opportunity where should be available everywhere in Europe. The second is public health. Mental health disorders are very much preventable. Preventing childhood abuse, preventing poverty, preventing different socio-economic determinants can prevent also mental health conditions. So,
thank you. Paul?
Well, let me just maybe quickly repeat the call to action that is coming out from the EAN strategic roadmap towards better brain health 2024-2026. It will be open and let's say it can be seen very soon, very quickly, to the general public. Be aware that you have a brain and be aware of all the possibilities to keep your brain healthy. Secondly, to healthcare professionals, promote brain health, become ambassadors for brain health. Thirdly, to the politicians, keep your promises and just adopt to the IGAP, the Intersectorial Global Action Plan, commitments that your country has made in the World Health Assembly.
Thank you. And Harris, reflecting on that, so having a kind of more helicopter view, are you calling for a Marshall Plan for the brain? between US and Europe?
Well, I think Marshall Plan is not ideal because America doesn't want to impose itself on the European economy.
Thank you.
But I think let's do a NATO for brain health. We will not achieve these skill-based transitions that we need to go through, like the digital transition and the green transition that are intensely skill-based, unless we have at the foundation of it the brain economy transition. So, join us in these sort of economic discussions. Let's get out of our comfortable health policy zone and start to crab walk across into other sectors with good science and good judgment.
Thank you. I'd like to invite you to give a round of applause to thank our panelists as we will be moving on. Thank you very much. And convening Elena on stage back again to moderate the second panel that is going to address the policy frameworks and national strategies for brain health.
Thank you very much, Fred. You stay because we changed the hat. And I want to invite Professor Mika Martikainen, who is with us. He's a professor of neurology at the University of Oulu in Finland, vice president of the Finnish Neurological Society, and the chair of the Finnish, maybe you sit there, Mika, of the Finnish Brain Council. Sit down, sit down. And we have Fred with us, and you didn't say anything about EBC, but maybe you have the chance to say something later. I don't know you, but I feel a bit uncomfortable after hearing from our colleagues, the psychiatry and the neurology, what is coming up in Europe. A sort of, basically, 40% of us here will develop a neurological or psychiatric disease. So how we can stop or reduce or make a change in Europe to avoid that this big cloud, like the climate change, is unstoppable. I think this is the time, but we need political actions. We need to put together forces and make a change. So we have the example of Finland. We have also Switzerland. We have Italy. We have, I think, Macedonia now is starting. Other countries in Europe who have already started these brain health strategies. You are a champion in your country, in Finland. We know that the Nordic area are very important in making a change in fostering. So can you tell us a bit more about these Finnish brain health plans?
Thank you, Elena. Thanks for the audience for being here, and thanks for the organizers for inviting me to present today. So in Finland, the earliest projects for a brain health plan started already in autumn 2021, and since that we've been developing our systems, and the currently the major organization behind or working with the Finnish Brain Health Plan is the Finnish Brain Council, which is part of the European Brain Council, and we are also a hub of that combines or brings together both medical associations and patient organizations, and also other partners like pharmaceutical industry partners together. So in the previous panel, we heard really good insights already on the importance of brain health, and we also try to look at brain health specifically with the contents of both neurological disorders and the psychiatric conditions and mental health, as well as neurological brain health. But apart from the disease perspective, I think it's very important also to look at brain health as a positive phenomenon, to look at well-being of everyone in society, how we can have a well-functioning brain and mind for our education, our work, also in the later life, and these are I think also key elements in what we're trying to incorporate to our strategy, things that support this perspective, and not only, which is very important, the disease perspective. So, to quickly summarize about the disease perspective, I think it's very important that everyone knows there's a lot to do for the diagnostics and care and rehabilitation in neurological and psychiatric disease. So we need resources for this, and we need efforts in this to improve the ways to care people and also bring back health for people affected by neurological and psychiatric conditions. But I also think we would need to have a broader perspective, like a societal perspective, and think maybe that how we can have a society that promotes brain health, that contributes to brain health. And here I think it's very useful to take a look at the WHO brain health determinants. We know that education is very important. We know that healthy working life environments are very important. We know that safe and stable surroundings for families in the early childhood are very important, and to prevent isolation and loneliness, and to promote social collaboration in later life, they are very important. So this sort of, I think, more a comprehensive approach is definitely needed, and this is what we're trying to do in Finland.
And how did you organize this plan? So you have a short-term objective, middle-term objective, long-term objective. How do you organize this plan in Finland?
Yeah. Thank you, Elena, for this question. So definitely, I think continuity is extremely important. These are very difficult things. We cannot get these sorted and done and dusted in 4 years or 5 years or anything like this. So this will be a project that will go on, and we have to develop a system that incorporates continuity, so that we can have medium-term goals, and then the long-term goals, and also create changes in society that keep these positive things going in the long run. This is very important.
You are investing in the brain.
Yes.
The brain capital.
Yes. So So as Harris rightly pointed out previously, in modern knowledge societies and for economic growth for all of us, it's extremely important that we have healthy brains and that we can keep our brains healthy as long as possible to later age. And one thing I would still like to point out is the multidisciplinary point of view, which is very important. So we need to have. It's extremely important to have the patient organizations with a broad perspective, broad spectrum on board. We need to have both neurologists, psychiatrists. We need to have the primary care involved. We need to have other health professionals involved, and also definitely we need to have both on national level and EU level. We need to have the governmental organizations and EU level organizations on board to work on this together, particularly in the EAN and EBC context, so that we have support to promote brain health for everyone within EU and around EU, because this cannot be done by any national organization by themselves.
Thank you, Mika. I will go back to you later. So now, a question for you. More than one, maybe. So, Fred, you are representing EBC and will tell us what does it mean in Europe. So you have a big challenge as well, because there are these plans coming and trying to get attention in Europe. How can you foster this essential plans in Europe, in the countries. What is your plan? What is your suggestion also as EBC, very important structure in Europe?
Thank you, Elena. Well, there is a short and a long answer. The long answer is probably for tonight around a glass of wine or a beer. But let's say the momentum we are in is actually very interesting because we see the emergence of those national plans. It's part of a long-standing vision or request or call by EBC since a couple of years to see countries taking up the needs to, as we were saying earlier, invest into research or take on the challenge of addressing the burden of brain disorders. But Paul made reference to the Global Action Plan of the WHO. So that's actually the one on epilepsy and neurological disorders. But we can add to that the Global Action Plans on dementia and the one on mental health. What's interesting, all combined, they all have objectives by 2030. And they are requesting or inviting member states to start developing their own national strategies to mirror the key objectives of each of those global action plans. So if you make the math and if you consider 2030 as the target, obviously the next mandate at EU level is extremely important. And if you have seen EBC active on social media and in Brussels with the EU institutions in the context of the EU elections, it's because we are aiming at really making sure Europe is not missing that train. Why? Because if at global level we have these priority needs, at national level there is that work, there is definitely one level of coordination that would generate an opportunity to help member states define those strategies and put that in place. And I think that based on what Mika just said, there is also the potential to go beyond and to build on the additional elements that we would see that would transcend based on what Harris shared with us a little bit earlier. So what we are doing, and just to conclude on this, we have opened via the EU Health Policy Platform, sorry for the jargon, but we are in the right place for that. So it's a platform online coordinated by DG Santé. So a thematic network that is actually getting the input and aiming at consulting the stakeholder basis across Europe in order to build the building blocks of what a future coordination plan for the brain would look like at EU level. And we have to release the outcome of that work on the 26th of November. So we have here a very stringent deadline in that respect.
So I think this is wonderful. And are you taking, because I think what you learn over these years, we are lucky that we have already people who started, nations who started, and maybe there are some mistakes that have been made, because it's something new. And when something is new, we have to learn. There's a learning process. So do you have any suggestion, what you learn from these initial years that you can tell us for people who have to start, the government who have to start these plans?
Yeah. If I start with the positive things, I would say one of the key lessons or takeaway lessons is to start somewhere and get going, because I think these are complicated things, and one of the mistakes might be that you keep on planning and planning forever and you never get started with anything. And I think even an imperfect project is better than nothing. So it's very important to get going. But also I think it's very important to listen closely and get connections with all the relevant parties, patient organization, governments, the professional associations, and in an interdisciplinary way, health professions, listen to perspectives, listen to what are the key needs and the key issues for everyone involved, and then try to work on this. And this is also a way of getting all the relevant parties on board. Because otherwise, if you miss out someone, or if you leave out relevant people, then you already have sort of a hampered system, and then it's difficult in the long run. So I think it requires a lot of discussions and a lot of time, but I think then eventually it pays off when you really feel you can be confident that you have all the key people on board.
So Fred, in this platform, right, because we need the Ministry of Health, but also Ministry of Education. We are talking about educating people. How do you plan to do that with the new parliament, with the new commissioner? Because the key, I think, to put everything on the same page. You know, this is what we need to do. So, and it's not easy. We are learning. So, how do you see that we can foster these next actions?
Well, it's a very important question because there is definitely a risk of silo thinking that is then prolonged. And I know that there are loads of discussions here in parallel groups as to how to break those silos with like shared responsibilities and also shared funding in a common stake. And to take Mika's point, I think we also need to learn from success stories and successful examples. And as Harris was mentioning, we just flown back from New York, where we had events last week, and we met delegates from Cameroon. Believe it or not, but their government came up with the Yaoundé Declaration on the positive brain economy that was signed by the President of the Republic, and it's now becoming the blueprint at policy level that was presented to the government, and every one of them, every minister, is coming to that agenda and to really think what are the policy needs in my portfolio that I would need to implement in order to respond to that objective. Even the Minister for Forestry, even the Minister for Agriculture. But you mentioned, of course, education, employment, social affairs. I mean, with the examples that were given by Paul earlier, I think that we can really relate to that and really be ambitious, I would say, in the way by which we can spill over in those policy areas. Just a word also to say we need to start and establish ourselves or establish our roots in the initiatives that exist already. At European level, we will have the Brain Health Partnership that is currently under construction. So it's really the alignment of all countries around the key strategic priorities in a common agenda in order to streamline funding and accelerate the funding in excellent science. So this is going to start in 2026 and is in the making as we speak. So that's a very important, I would say, landmark for us on which we can build. Obviously, there is the Healthier Together, so it's the strategy on non-communicable diseases, where we know are very hopeful to see the pillar on mental health and neurological disorders being ambitious and impactful. So these are already, let's say, 2 milestones on which we hope to build. And with the announcement of the new College of Commissioners, we see that competitiveness, we see that innovation can be also avenues of work where we see connections between those policy environments. Plus, it's probably anecdotal, but I find it's quite striking. The fact that we will have a commissioner for housing is, to me, very emblematic of the way by which one of the key risk factors, particularly in mental health, is now at the highest political level in Europe, having a dedicated portfolio for that, because we know that homelessness can have a detrimental impact for mental health and other conditions. And okay, there is probably another session needed to explain on all the implications here.
So I'm very happy that we will pamper our brain in the next decades, and I think also for the new generation will be extremely important, because otherwise, you know, the Cameroon people are already investing in the brain capital, as Harris said. So I think, so thank you so much, and maybe now in the round table we will discuss a little more the practical things. So thank you, Mika, thank you, Fred.
Thank you.
And Fred, I don't know if you want to introduce the next part of this session.
Sure. Well, actually, as promised, and we're hoping we gave you the right pointers to open all the discussion, because you are going to work. And we hope you're ready for that at 5 o'clock in this afternoon. But all the topics that we mentioned actually ought to be fed in this conversation, plus also your perspective. So we invite you to move seats and come around those round tables. You will see that name tags were put in the middle of those, because we would like to separate in 2 groups, one addressing the fostering of national and regional brain health plans, and you will have 3 colleagues helping you out to work on this topic. So it will be myself, Mika, as well as Mike from the team of the European Academy of Neurology. And the second topic, topic number B, is investing for the future of brain health. And that's going to be moderated by Paul, Martina, and Harris. So colleagues, join us around the round tables. Otherwise, I'll have to walk at the back of the room and kick you in. Awareness and the management of diseases, the link to comorbidities, the impact of delayed diagnosis, issues around access, the time that patients can spend with their doctors, the out-of-pocket interventions very often for brain diseases, the pricing of therapies, the availability of treatment also. And then a point still in that vein on the social care and the lack of resources in community services also came about. And then examples, I think, yes, okay, two very important things, and that's why we're so passionate. It's the reflection of the heterogeneity of diseases and the need to have gender and diversity included in cohorts for clinical trials. And positive example, and I would commend that you talk to, sorry, your first name? That you talk to Stefania after the meeting, because she's a social worker having worked in HIV campaigns in particular. And HIV really came as a very interesting use case, also because it relates to the expertise that patients can bring in living with their disorders, because that was the onset of the recognition and the understanding of HIV.
Very good. Very efficient. Thank you so much. We go to the other table, Mika.
Would it be all right if Josephine would explain, because you have written everything we discussed? Would it be all right for you? Yeah, if you don't mind. If you don't mind.
Thanks very much, Mika. I don't know. I wrote my thoughts, so it feels very one-sided. But I think we might have got a bit off topic. But did we really? I mean, our conversation went all the way into rethinking the whole paradigm of our society, right? It's based on growth and commodifying people and their time, and essentially all aspects of our lives can impact brain health. So yeah, anyways, that's a bit off topic. And we're thinking also that we're at a stage where we're running behind changes such as, for example, the transformation of digital, and we're not being proactive. We're being completely reactive, and we're running behind time. And we were talking about like how even the newer generations are somewhat never going to reach the current generations in terms of achievements in academia. So everyone who's born in the late 1970s, congratulations, you're the smartest people here, apparently, according to Mika. But it's apparently based on research. So that was part of it. I think one big topic for us was that we think that it's absolutely essential that brain health should be present in all policies, and we need to break down silos. When we talk about brain health, we need to have educators in the room, and this was mentioned earlier on the panel, but housing, education, work-life balance, all of these aspects are completely essential. And maybe one last point, again, maybe a bit off topic, but I thought it was interesting, is that it's interesting to also talk about the role of religion. And I know it wasn't mentioned in the panel, but for a lot of people that come from backgrounds that are, can be a bit more discriminated, religious leaders play an extremely important role when it comes to mental health. And even though Europe is becoming more secular, there still are vast numbers of people that rely on their religious leaders for essentially mental health support. So it was interesting to also mention this.
Thank you. Okay, then I won't continue anymore. Thank you. Thanks.
Thank you. Who wants to report from this?
I can start, and the bits I can't read, I'll ask someone else to do. I was born in 1984, so I don't know if I'm up to this. So one of the first things that we, discussing about investing for the future of brain health, one of the first things we came to our minds is that this is actually somewhere also where raising awareness is important, because the funders will need to know what they're going to fund before we see any money. From the get-go, many of them probably need to understand the distinction between brain health and mental health, and the fact that it's neurological and mental health in there. We also talked a bit about sometimes it can occur, some people had the experience, there can be a conflict between obtaining public funding for research or industry. And then it would be nice to see more and better funded initiatives, public-private partnerships like IHI as an example. And tied with that sort of whole process of applying for major funding programs, you know, we talked about capacity building. Do people really have the resources, time to apply for all of these things? And for some of them, the administrative burden can be pretty daunting. And then it occurred to me as well that we were talking about increasing brain capital in different sectors. That could also be an avenue where we increase the resources available. And then I'm just going to look up, can't really read that from accessibility results. So yeah, so you know, if we do see this increase, or if we do get more funding, we got to make sure that the results that come out of that are accessible. And so if there's new therapies, new devices, that those things that they're affordable. Otherwise, we might not keep getting support for that funding in the future.
Time's over. Thank you so much. Thank you so much. Thank you so much. Thank you so much. Let's go here. Who is talking? Paul?
Thank you, Elena. I'll try to be very short. The question on research priorities and how to find a mechanism to allocate funding in a more efficient way was to massively invest in research on preventive measures, leading to usable biomarkers, and then only limit in interventions to, limit the investment in non-responders. So you only would spend the money in interventions to people who are very likely to respond to your treatment. That would free money that is now being used for non-responders to new projects. It's just an idea. On the question whether we should fight for the bigger part of the pie in a closed portfolio system, the answer from this table was definitely yes. There is a point in fighting for a larger piece of the pie, despite some reluctance from policymakers basically thinking, you know, we are neurologists or psychiatrists, there is no point in making this a war or a fight among diseases. Still, in the presence of a closed portfolio, it is a competition. We should just go for the competition. This is the recommendation from this table. How to do so? By creating alliances, for instance, with important people, politicians, celebrities, things like that. Make sure that you are more visible, and by being more visible, creating more awareness, you would get automatically a bigger piece of the pie. Reiterating what was just being said, brain health, what is the concept? We need to explain it more. It is not commonly associated with neurology. Second, another suggestion, we do not seem to have many influencers in the field of neurology. Well, there's many influencers on social media that promote other things. The use of slogans is strongly recommended. You only have one brain. And last but not least, the statement, investing is not only a question of money, it's also a question of time and attention. Thank you.
Very good. Thank you so much. Martina?
Okay, so we had also the same three questions here. About investing in brain health. So first was the question how to ensure sufficient funding for brain. And here was the discussion about really, the naming and brain health versus mental health, because these terms might create also some kind of, and I'm not sure what is actually mean from brain health, and it can create simply non-understandable language, and therefore was the discussion which is better. However, brain health is associated more with positive brain health, and it was agreed here that many people would then relate more easily with brain health when it comes to mental health, which is more stigmatizing as well. Stigmatizing in the way that when you come mental, you think about psychiatrists and pathological conditions, where when you're talking about brain health, it would be like some positive. And so some positive, more people can relate and more people can be aware. So it was one of the ideas. Of course, also this awareness then is linked to lobbying and to lobbying in different sectors, also to relate, one was to politicians, but also to health professionals, other professionals within other sectors working closely on the field of mental health. Then there was a question how to prioritize unmet need, and one of the idea was to go how to prioritize how to prioritize to whom to give the funding. And one of the responses was to follow the unmet need. So the unmet need would be that there is a kind of a survey where qualitatively and quantitatively it would be detected some indicators of health. And then based on these indicators, see which are the unmet needs for these specific disorders, and then among disorders and for what disorders have the major unmet needs, there the funding should be allocated. So it can be done based on the patient's responses, on what he thinks or her. It also can be done based on some statistics in terms of life expectancy and so on, and combination of this. And the third question was, are there existing funding mechanisms that can be leveraged in Europe? And so since brain health is actually can be related everywhere, there could be funding from different sectors. So from education, the women's issue, workplace environment, even foreign ministry, just working on the best changes of practices, well-being, healthy aging, even Ministry of Defense.
Thank you very much, Martina. A nice quick summary. Minister of Defense, la Défense.
We should get them to unpack their defense comment a little bit. Okay.
Pentagon. Let's go.
The NATO for brain health. Okay, so we had 4 buckets to share, but I'm doing my best to synthesize. The first is that if we're talking about investing in brain health, what are we investing in? And there are many different assets, if we think about it that way. There's research, there's digital tools, there's devices, there's drugs, there's buildings like clinic networks and schools. And then there is caregiving infrastructure as well. So there's a lot of different components to potentially brain health investing that we need to think about. The second one was, let's not just think about government money, let's think about different types of money and blending different types of money. So the private sector can be a source of money, and philanthropy can be a source of money. So we must think about public-private philanthropic blending and mixing. And that means anyway, blah, blah, blah. So you guys get it. And one interesting thing, the European Investment Bank, we were with them last week in New York, and they're very interested in this space about how do they future-proof Europe. That's what they do. And so future-proofing Europe means investing in the brain health of Europe. And maybe Fred and I can talk more about that after the session. The third one was regulation is key as well. So not just investing in brain health, but maybe we need to regulate social media, regulate pesticides.
Thank you very much. So we don't have too much time. I will invite the speakers to come quickly to the podium because we need to thank you. Maybe we propose that we have a sort of written summary of what we discuss in these tables, because it's really very important, right? And it's really a treasure that we don't want to waste. Why we don't sit quickly. So if I can summarize, first of all, thank you all of you, the speakers. Fred, don't be shy, come. And all you who have contributed to this discussion and to sharing your feelings. If I can summarize, I would just say we need more awareness for the brain health campaign, but we are not at the point of no return. So we are actually starting. And this is a very positive message, so that we are very inclusive. So we are like psychiatry, neurology, psychologists, neuroscientists, everybody who is interested in what we have here inside, which is a precious treasure for everybody. So we want equity. We want really to open to everybody. We want to ensure that everybody has this right to be treated, to preserve the brain. And we will be ambassador. So we are here to be ambassadors in our countries, to move and to shape, as I said, the future. We have a lot of young people here, and I hope that now you have the power to empower the other people to get much more involved in these essential matters, which matters everybody. So I don't know, Fred, if you want to add anything else, because we are 5:47. So thank you again very much, everybody. And let's go in this mission, brain health mission. Thank you very much, everybody.